Hello, I'm Jeff Gold, and thank you so much for joining us today on this Maverick Minute. We have the pleasure of being joined today by Mr. Cecil Hicks, and of course you know that Cecil is our Assistant Vice Chancellor and the Director of Human Resources here at UNO. As many of you know, last May, the university announced that we're going to change our third-party administrator for both our health benefits plan and our dental benefits plan. We're going to use URM for our health plan and Emeritus for our dental plan. And there have been many questions that have occurred by our employees and their families about continuity of services, who to call, when to call, etc. And there have been several recent town hall meetings. So Cecil, I'd like to start to talk about that and have you answer some of the common questions that our employees have been asking me. But for the most part, you've participated in some of the recent town hall meetings on campus, and I know you've been involved in some of the central administration meetings. What type of changes do you think our employees are going to notice most?
You bet. Well, great, Chancellor. Thank you very much for this opportunity to talk about this very important topic. You know, I think the employees will be very excited, and from some of the feedback we're already hearing, that they're going to be very excited to hear some of the specific benefit enhancements that we're seeing in the plan. Some of those include, I'm not going to be able to cover all of them, but some of them include 0% copay for flu shots when in a network pharmacy.
I already got my flu shot, by the way.
That's good. Everybody needs to get that flu
Absolutely.
shot. You also will see some changes in fertility and sterilization. They'll be covered. There'll be some changes in the premiums will be going down 2% basically for the health care there, and also as well as a 25% reduction in the long-term disability coverage as well.
Well, all of those are really exciting, and I've had a good deal of positive feedback too. But a lot of the questions that I get asked are things like, will I be able to keep my doctor? Or I prefer to use one hospital or another hospital. Or, you know, in my case, I've had my dentist for 20 years. Does that mean I have to change my dentist? And so what are the answers to those kinds of questions? You
know, what I would probably encourage folks to do is to check on our website and check and see if their doctors are in the coverage in the network. What we're finding is the bulk of them are covered, and it is going to be limited disruption in the coverage from both the dental side and the healthcare side. So checking and see if they're included in the network would be to go.
And how do they check? They go to the website and just look up their doctor or their clinic or their hospital?
Absolutely. If they go to our website, there will be links to that, to both the UMR website as well as the Emeritus website, and it's pretty easy going, and it's pretty much specified for us in the university system, so they'll be able to go and check and see if their doctor is there, and if they have any questions or have any troubles with that, they can also contact our office as well.
Well, you know, I can just tell you I had a very recent experience with one of our UNO employees, actually a faculty member, whose wife's going to have a baby in a few months, and they were looking at the website, and they were really pleased with the information that they found, and I think there was a lot of anxiety. You know, healthcare is so personal.
Absolutely.
It's what does it mean to me, and you know, and it's not just can you get to a doctor or a clinic, but people build long-time relationships with their caregivers, and it goes far beyond the routine office visit or the minor procedure, but it has to do with building a lot of trust. And the maintenance of that, or the opposite of it in your and my world of minimizing disruption, is so very important. And I'd like to thank you, because I know you've worked really hard to communicate this information. I know that our central administration has also, but you particularly have done a great job in working with our faculty and our staff, and I think it's been very successful. Well, I look forward to providing more information, and I hope that employees feel free to reach out to you.
Absolutely, I want them to reach out, Chancellor.
Well, and I know they will. Thanks for being with us today.
Well, thanks for having me.
And thank you for being with us today on this Maverick Minute.